Hello everyone, I am Dr. C. Madhu. I am a consultant physician and I have been practicing diabetes and internal medicine and clinical cardiology for the last 3 decades. This program is about health education for diabetes. Diabetes or Madhu, which is as such called in the Indian languages, is a disease which has become now very common, almost on epidemic proportions in our country as well as in the world. What is diabetes? Diabetes is a disease where the glucose metabolism in our body is deranged and glucose is not utilized for bodily functions, and it causes also lot of complications like disease of the small blood vessels and disease of the large blood vessels, thus causing heart attacks, strokes, and kidney problems, eye disease, and nervous problems, and infections. Why diabetes has come in such epidemic proportions in the world? This is an enigma for all the scientists to think about. According to the Indian International Diabetic Federation, there are about 36 crores of diabetics in the world, and there are about 7 crores of diabetics in India, and mostly our country is now second in the world in the number of diabetics, while China is the number one diabetic populated country in the world, and the third one is USA. The burden of diabetes is in its complications. Whatever food you have taken is broken down into carbohydrates and glucose, and proteins are broken down into amino acids, and fats are broken down into fatty acids and glycerol in the body. Out of all these substances, glucose is the main substance which causes energy for the human body. It goes to the cell and takes part in many chemical reactions, thus causing energy and giving energy to do many functions of the body. These derangements in the metabolism of glucose will cause derangement of all these chemical reactions, and there is also derangement of the fatty metabolism and also protein metabolism, and there is accumulation of fat which is called in the scientific terms cholesterol or triglycerides, and this fat is accumulated in the blood vessels, and also there is derangement of the nerve conduction in the various nerves of the body, thus causing neuritic symptoms, and the small blood vessels are also blocked in eyes and kidneys and the peripheral nerves, thus causing these symptoms. This is briefly the problem of diabetes. So, why should we control diabetes? Because the burden of diabetes in its complications. So, most of the patients present to us with complications, and if only they have health education, if only we can screen them for diabetes at an early stage, and if only they can control their average blood sugar, which is measured by hemoglobin A1C concentrations or fasting blood sugar, all these complications can be prevented. This is the basis of the health education. The treatment is one part and the awareness is the other part. If you are aware of the complications, even as early as 35 years of age, you can start screening for diabetes, especially if you are having a family history of diabetes in your parents or grandparents, especially if you are having overweight, especially if you are having recurrent infections, especially if you are a woman and had miscarriages and abnormal pregnancies, especially if you are having high blood pressure and symptoms like increased appetite, increased urination, increased thirst, and loss of weight, and infections which will not go away, and ulcers which will not go away, and genital infections like urinary infections, itching in the genital areas. You must check for and you must screen for diabetes. Once you diagnose diabetes, you could take the help of a good doctor to treat your diabetes depending on the stage in which you are in. So, I have planned to give a series of explanations for you, for those who are interested about diabetes on this World Diabetes Day, November 14th. Introduction, how to screen, and what are the precautions you have to take, the dietary plan, exercise, and oral hypoglycemic drugs, insulin, how to use it, and how to face the complications when they really come. Hope you will follow me on this channel every month or every 15 days to learn about diabetes and its prevention and the care you have to take if you are a patient or if you are at risk for getting diabetes as explained to you just now.